Like most other industries, the life sciences industry is also waiting with bated breath for some kind of direction from the new government in terms of policy changes, in terms of incentives, in terms of the manner in which impetus could be provided to the sector. If you look at pharmaceuticals, several problems plague the industry from a legislative standpoint, be it the process involved around clinical trials, the confusion regarding foreign direct investment in pharmaceuticals, multiple regulators that the industry has to deal with, the growing dependence on China for active pharmaceutical ingredients. Whilst there are also a number of areas where there are issues in taxation, where taxes need to be rationalized, where duties are still a little high in some of the areas. But more than issues related to taxation, it's really policy-related issues which need quick and brisk action if you are to see the industry really gaining its place, which it can. There is a new wave that is emerging in the life sciences sector, and that wave is marked by innovation. However, for innovation to succeed, there is no real incentive for innovation in terms of, if you just look at the risk attached to failure and the stigma attached to failure, just to address that, the government needs to incentivize innovation in a much larger, bigger manner. We've had some elements of it through some policies of PIRAC, but this needs to be strengthened. If you look at the tremendous dependence that the country has on China in terms of active pharmaceutical ingredients, the government must necessarily incentivize new industrial parks. It must incentivize manufacturing of active pharmaceutical ingredients to be in a more competitive manner in India, and that can happen only with one, speedy clearances, rationalizing of duties. You have a fairly stiff excise duty on active pharmaceutical ingredients. So all these need to be looked at in a holistic manner. At this point of time, you have three ministries that the industry has to deal with. You have the Ministry of Health, then you have the Department of Pharmaceuticals, and of course you have the Department of Biotechnology. Whilst drug approvals sit in one ministry, you have the pricing regulations which sit in another. So you have a multi-pronged system that the industry has to deal with. Finding a single regulator has been a quest of the industry for several years, which has remained unaddressed. So from a longer standpoint, even if you look at fiscal incentives, which may take some time in happening, even if a clear policy direction is provided, it will be a step in the right direction. From a life sciences perspective, the percentage of spend of India as a percentage of GDP on healthcare is still fairly low. If you look at even the quantum of vaccines, the government has recently increased the number of vaccines under the universal immunization program. That too needs to be increased. So one needs more of a holistic view rather than, unfortunately, I think what has happened is because this falls under various ministries, you have seen each ministry doing something in its own isolated manner. It's time that we take a holistic view cutting across all the three elements that impact the industry.